All right, welcome back to Nurse Franny. This episode we're going to go over some bones important for a lab practical. So if you have a practical involving the skeletal system, you should probably master the following bones. There's a frontal view of the calvareus, the skull cap, right there. Now, the skull cap, we can see here the frontal bone. It's divided by these sutures. Sutures is a type of joint. The suture is a fibrous joint. Here we have more sutures. And here we have frontal bone, parietal bones, right, the ones on the sides, and the one in the back, occipital bone. What I just pointed there, this is the occipital protuberance. It's a small little bump on the back of your head. You can feel it right there. Here we have the glabella. I circled it right here. This is your glabella. We have your temporal bone, right where this number 58 is. And your temporal lines, it's an arch that goes from here, goes all around the side of your skull. So your temporal lines. I'm putting my pencil through the zygomatic arch. That's your zygomatic arch right there. And where you see this number 112, that's your zygomatic bone right here. Your cheekbones. Here, here, and here. Now, it's a bit confusing at first to understand this concept, but number 75 and number 4, these are two different processes. Number 4 is a temporal process of the zygomatic bone. Number 75 is the zygomatic process of the temporal bone. The tip here, or the trick, is to understand where the bone is coming from, or where it's attached, where the process is attached, right, to which bone. Number 4 is of the zygomatic bone. This number 112 is the zygomatic bone. Number 75 is of the temporal bone. And number 58 is the temporal bone. So you have the zygomatic process of the temporal bone. Now, if we turn this around, I'm just going to go ahead and separate this mandible from the skull. And if you can see here, this shaded black part where the mandible fits is called the mandibular fossa. I'm going to do that again. I'm removing the mandible. These two shaded areas, exactly where the mandible aligns and fits, that's called the mandibular fossa. This right here is called the mandibular condyle, or the mandible condylar process. It's right here, right there. That little red spot on the left of number 131. I'm going to flip this over just for you to have a better look at it. Where my pencil is resting is a mandible condylar process right there. And it is number 150. Is it 30 or 50? That's a 30. 130. Now this is a coronoid process. 133 is a coronoid process. And if you can see it on the board, we're going to try to draw it. So we have, let's see. Okay, so here, let's see. So this area right here is the mandible condylar process, or the mandible condyle, or the condylar process of the mandible. This over here is the mandibular fossa. Remember that fossa is just a little cave in where you have a bone. Okay? That's your fossa right here. So right here, so this is your mandible, and this area right here is your coronoid process. Now the way to remember coronoid process is that you say no with your mandible. Right? Now that we got the mandible out of the way, let's go over, sorry, that's all discombobulated. Okay, so let's go over the mastoid process and the styloid process. The mastoid process is this number 60 right there. That little guy right there, that bump right there. That number 60 is your mastoid process. Your styloid process is this little guy, this number 72. It's sticking out. It's not parallel to the mastoid process, but it's very close to it. I'm going to flip it over in case you need to see it this way. This pointy thing over here, protruding very close to the mandibular fossa and very close to the mastoid process, this little pointy thing here is a styloid process, because it resembles a stylus. Now let's look at the external acoustic meatus. External, it's outside. Acoustic, for ear. Meatus, I don't know what that means, but here is your external acoustic meatus, right in there. Your internal acoustic meatus, if you follow through the external acoustic meatus with a pencil, your internal acoustic meatus would come out of here and be right there. This channel connects this channel right here. The occipital bone, you rotate your calvaria. This is a lateral view of the calvaria. This is your frontal bone, parietal or parietal. I'm not sure if I'm pronouncing it right. And this is your occipital bone. It's right here in the back as well. The occipital bone, I'm going to call it number 30, not number 30, but it's, yeah, right where those two red lines are. This is all the occipital bone. And number 20 is the external occipital protuberance. The occipital condyles, I'm going to put this in place, right here, here, and here. If you look at it from above, your occipital condyles are lateral to the foramen magnum. So this is your foramen magnum. And right here is a condyle. Number 25 is a condyle, an occipital condyle. And parallel to that 25 is the other occipital condyle. Your sphenoid bone is where this number 3 is, right here. This suture, well not suture, sorry, but this little line here, where this number 3 is your sphenoid bone. And we can look at it from above. This butterfly here is your sphenoid bone, right here, your sphenoid bone. Here, this little saddle, this darkened area right here, I'm going to put it to the lateral view so you can see it a little better. This little space right here, this is your sella turcica, right here. Sella turcica protects the pituitary gland. Your pituitary gland sits right here where my eraser is, then your sella turcica. And this over here, this is your cribriform plate. Number 15 is your cribriform plate. C-R-I-B-R-I form plate. And this fin is a crista galli. Crista galli, right there. Now, sorry, this is all discombobulated. We're looking at some nasal bones right here. So number 86, nasal bone, right here, here and here. Right here where this number 17 is your lacrimal fossa, and it sits, or it makes a hole through the lacrimal bone. Number 30, right here, this is your ethmoid bone. This little pointy part right here, 101, this little pointy part right here, this is your vomer. This part right here is your perpendicular plate. Okay. This is your maxilla, and this is your mandible. The holes where your teeth go are the alveoli. Very important. You also need to know where your sinuses are. These black parts right here, these are your sinuses. Your frontal sinus is right here. Right here. This is your sphenoid sinus. Your ethmoid sinus is somewhere here. And your maxillary sinus is right here. Okay. Sternocleidomastoid meatus. It's one of your condyles. Right here. Actually, is it one of your condyles? Yeah, it is, right here. This is your mastoid process. This is a styloid process. All right, so right now we are going to, let's see, I think that's it for now. We know, oh, that's right, soft palate and hard palate before we leave. So right here, number 107 and parallel, that blue marking there, that's your soft palate, palatine bones. The number 103, I think all the way up to, yeah, number 103 and to the right of it, those are your maxillary bones. That's your hard palate. So hard palate is more superficial or more closer to the outside than your palatine, than your soft palate. So hard palate first, then your soft palate. And I think that's enough for bones in the skull, for now anyway.